Absolutely. So it's interesting because from 2020 we are entering what the World Health Organization is calling the decade of healthy aging. So there is a lot of focus even at a global level. In terms of the UK, we now also have a big project starting in April 2020 called the Aging Well Programme. And I'm delighted that in our Derbyshire STP we have been ahead of that curve because we already developed the Derbyshire Community Frailty Model, which is seeking to achieve a lot of the ambitions and the objectives of the National Aging Well Programme. And I'm even more delighted because DCHS as an organisation has looked at that horizon and made sense of all of that in the DCHS Frailty Strategy, which we have developed. So the DCHS Frailty Strategy has been developed over the last 3 years. We have had the contribution of a significant number of colleagues, not only within DCHS but from across the Derbyshire system, who have helped us to really shape what our strategic direction should be in relation to looking after older people living with frailty. We're trying to achieve 3 key things. One of those is to treat frailty as a long-term condition in its own right, not just a word that we use to describe people. The second thing we want to achieve is to proactively identify people living with frailty so that we can provide a comprehensive assessment of their needs. And finally, we want to get to a place where we put in place a personalized care plan that really reflects the needs of that person, not just their medical needs, but their needs in terms of their social circumstances, their health needs, and whatever else matters to them. So I think one of the drivers, a key driver for this change in direction is that we want to shift a number of things. As I said, we want to move away from frailty just as a descriptor to frailty as a long-term condition. We also want to move away from people presenting in crisis when they've already had a fall or they've had an episode of admission because they're confused or because they've lost their mobility or they've been in and out with water infections. We want to move away from that crisis approach to something that is more proactive because we are being more deliberate about finding out who these people are before they hit crisis. And having done that, we want to move from a type of care that is disjointed, that is hospital-based, that is reactive and not great experience for people, to care that is proactive, that is coordinated, that is community-based, and has the person right at the center of what we're doing. That's the big driver for the changing direction.